The nearly one-fifth of Americans who live in low-income communities experience systemic challenges that prevent them from achieving their optimal health. Many of the root causes of poverty and poor health are the same, and the community development and health sectors have worked for decades to address these challenges. However, these two sectors have often worked separately, even when serving the same places and people. A better approach? Coordination and connection. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, senior writer with AHA. The Build Healthy Places Network is all about bridge building, finding ways to tie together and thus magnify the positive impact that community developers and health professionals can have by working together more closely. In this Voices on Value podcast, Julia Resnick, Senior Program Manager with AHA, speaks with a leader in this work of busting out of professional silos and making a difference together. Julia?
Thanks, Tom. Hi, I'm Julia Resnick, Senior Program Manager at the American Hospital Association. Today's podcast comes from the Value Initiative, AHA's strategic effort to improve value and affordability in healthcare. Our conversation is part of the Value Initiative's Voices on Value series, which shares diverse viewpoints on value from beyond the healthcare field. I am so pleased to be here today with Dr. Doug Jutte, Executive Director of the Build Healthy Places Network, to discuss how healthcare and community development can work together to advance value. Doug, thank you so much for joining me today.
Thanks for having me.
Can you tell us about your background and how it led to the creation of Build Healthy Places?
Yeah, of course. So I'm originally from Ohio, grew up on a farm in Ohio, and after becoming a doctor, I moved to California for my training as a pediatrician. And my first job after residency was in the town of East Palo Alto, which is one of the poorer communities in the Bay Area. And I realized quite quickly that all of my medical training hadn't really taught me how to manage what was really influencing the health of the families I was seeing there. And at the time, this is almost 20 years ago, the term social determinants of health was not really in regular usage, and in part as a response to sort of trying to better understand my role as a physician, as a primary care physician in the community. I did a public health degree and then did a fellowship in population health social determinants, and actually did disparities research for a little while. And what that all sort of led to was my realization that we were studying the problem, poverty and discrimination and other things over and over, but we weren't tackling them directly. And the Build Healthy Places Network arose from really recognizing that there's this sector, this community development sector, that much of their work is really focused on reducing poverty and improving the fabric and resources available in neighborhoods to improve health, even though they weren't using that language to directly address the social determinants. So that's really where the network arose from.
That's great. And so Build Healthy Places really lives at that intersection of health and community development. And for our healthcare listeners, can you explain what exactly community development is and how it works and who the major players are?
Yeah, absolutely. So one thing, a caveat, is that the term community development is used a little bit differently in different places, and particularly in global health. There's a broader, or I'd say broader definition or use of the word community development. Here in the United States, it's fairly specific. It really refers to an actual industry, a sector of the economy, not exclusively, but largely nonprofit, that invests upwards of $200 billion a year, specifically into low-income neighborhoods. So these are the organizations, the folks who are building the affordable housing for families and elderly and veterans, the ones that build supportive housing for the homeless and medically fragile, the grocery stores and food deserts, childcare and early learning centers, community clinics. They invest in small businesses. So for me, actually, as a physician, when I first sort of learned about this sector, I was like, I didn't know how those things happened. And now I do. And in fact, what's interesting is this is really a transition from years ago when these types of investments were made in a very centralized way through the federal government. In cases you think about the Housing and Urban Development, HUD, building affordable housing. That's really not been true for several decades now. In fact, now it's really a network of thousands of organizations that are really present in every community across the country. One of the attributes of this current system is that they're able to access and use large-scale federal and state resources, financial resources, but provide them at a local level with local knowledge. There's several major categories, the way I think of them, that are engaged in this work. One is the affordable housing developers, both nonprofit and for-profit affordable housing developers. There are CDCs, they're called, not the CDC in Atlanta, but CDCs, Community Development Corporations. It's about 4,000 or more of these across the country. So again, as a physician early on, I was shocked to realize how many of these organizations there are. These are the grassroots, local organizations that help drive these resources into the ground, identify the problems that need to be solved. There's another category, which are the what they call CDFIs, Community Development Financial Institutions. And those, in my mind at least, we can think of them as nonprofit banks. And so they're not out to make a profit. They're just a way to weave together different sources of money, different financing tools for the local community. And there's a lot of expertise required to do that. And then importantly, the actual for-profit banks are involved as well. And that's because of regulation and their requirement to invest in the neighborhoods through something called the Community Reinvestment Act. And so to finish, where does the money come from? I think that's always an important question. And it comes from a number of sources. About a third of it is coming through tax credits, curiously. I mean, again, something I was relatively unaware of. And so there's something called the Low-Income Housing Tax Credit, or LIHTC, as those in community development call it. Billions of dollars directed towards building affordable housing, which is really how most affordable housing has been built over the last 30 years. Something called the New Markets Tax Credit, which provides support for small businesses and job creation. There's the Healthy Food Financing Initiative, HFFI. That's often how grocery stores are being built, food deserts, for example. Again, billions of dollars. Community development block grants that go to states from the federal government. And the big one, about 2/3 of the total, is what I mentioned earlier around Community Reinvestment Act. Community Reinvestment Act was passed in the 70s and really not implemented until the late 80s. And it requires banks, for-profit banks, to invest into neighborhoods where they take deposits. So it really is a direct attempt to address redlining, the practice of not giving loans to low-income neighborhoods, often neighborhoods of color. And so this is billions and billions of dollars that banks are required to provide to low-income communities and are regulated by organizations like the FDIC and like the Federal Reserve.
It certainly sounds like there are many resources that are flowing into the community development field. So what is the impact of community development on health, and particularly on health equity?
As I mentioned, I think the focus specifically on formerly historically disinvested neighborhoods really puts it smack in the center of the equity conversation. These, again, were neighborhoods that were redlined, as the term, taking deposits but not being willing to provide loans. So these communities were long-term disinvested, not getting loans for small businesses, for new houses, for additions to your house. And the CRA, the Community Reinvestment Act, is really intended to undo some of that. And so it specifically drives these billions of dollars into low-income communities and communities of color. A lot of my work at the network is really highlighting the fact that investing in low-income neighborhoods is a way to tackle social determinants of health and improve the health of the residents that are there in a way that the community development sector historically hadn't really thought of itself as having a health impact. It also then provides a reason for hospitals and healthcare systems to think about how to work with the community development sector. And I think one thing I want to mention, because this tends to come up a lot, is the risk of gentrification that comes with these types of investments. That certainly is a risk, but when you actually look at the numbers, most neighborhoods are actually not at risk of gentrification. They're at risk of continued disinvestment. And so it's something one has to keep an eye on, but it's not always true in all places. You think about some of the center parts of the country where there's relatively little investment happening, but where it is happening, it's really actually community development in many ways I've come to think of as a way to avoid gentrification, especially the displacement associated with gentrification. In fact, they use what they call the 3 Ps of protection, preservation, and production of housing, specifically aimed at low-income communities and low-income people. And so, for example, Mercy Housing, I'm on the board of Mercy Housing. They invest in neighborhoods, build affordable housing, and also purchase existing affordable housing in order to protect it. So they actually would be a type of organization or other housers that would come in and save these homes for low-income community or low-income individuals, even if the neighborhood begins to become wealthier over time.
Mm-hmm. And didn't the network do some research on this recently?
Yeah, some of our research was looking at what the return on investment was for these types of community-level investments and making the case that there are both healthcare savings and societal savings for investing in things like affordable housing and supportive housing for the homeless.
So you're a physician and come from this from kind of two lenses. So what do you think the most compelling reasons are for hospitals to work with community development organizations? And how can that work improve value?
So the way I've thought about it is these community development organizations are, I use the term an action arm for tackling social determinants of health. And the contrast for me as a public health professor, actually, at UC Berkeley, is that forever, basically, we've had public health departments. And so something straightforward like lead, if we found or, new research was done that showed that a lower level of lead exposure was risky, there is a mechanism by which we can reach out to public health departments and let that be known and have partners and tools out there to address that issue. But with social determinants of health, what can healthcare do about that? It's housing and schools and clinics and grocery stores. Like, that's beyond really the capacity of a healthcare system. But here, you've got this whole sector that is doing exactly that work, that they're focusing on the social determinants. So it's an opportunity to actually directly work with organizations that know how to do this work well. And you think about in terms of, reducing costs, improving outcomes, patient experience, and sort of the low-hanging fruit in many cases is homeless populations are high utilizers. The savings can be really clear really quickly. But when I think about it, there are as many homeless as we have at the moment because we're having such a crisis. There's still relatively few compared to the overall population. And so in many ways, the biggest risk pool and the biggest opportunity for cost savings, I think, is what they call the rising risk. Those patients or potential patients or families who are getting worse, who are on the risk of being homeless or run the risk of developing chronic disease. And so the community development sector, really by history, they are derived from the war on poverty in the 60s. They focus on poverty alleviation. So that's their actual job. And so they're a perfect partner as I think healthcare begins to really grapple with social determinants of health. And, hospitals and healthcare systems shouldn't be building affordable housing on their own. That's not their expertise, but they are well positioned to partner with community development to make that happen more quickly.
So as hospitals are thinking about partnering with community development organizations, and that entire sector might be totally new to them, so what do you think they need to understand about community development in order for the partnership to be successful?
There's a couple ideas that I think are important for hospitals to understand. And so one for me is the idea of leverage. And leverage is a term that's not that familiar in the healthcare setting, but it is when you think about anybody that has a mortgage on a home is leveraging their resources. They're putting down a certain amount of money, but buying something much, much larger and gaining that additional value with the relatively smaller investment. That's leveraging the value. And so hospitals are well positioned to provide the extra capital, the extra money that would allow a project to go forward that might otherwise be slowed down for lack of resources. So effectively, I think of it as healthcare is well positioned to help accelerate work that's already going on. I think another issue is that hospitals and healthcare systems should understand that community development is, for better or worse, it's really predominantly around infrastructure. So a lot of their work is through investments, loans and investments. And so programmatic efforts like a exercise program is not something that community development is well positioned to help with. Investing in a park is hard to do. There's no way to pay down a loan based on a park. But a park next door to affordable housing where people are paying rent that will pay down the mortgage over time, that could work, for example. And so understanding where community development fits and where it doesn't, I think can be really helpful. But I think another idea hospitals can really benefit from is this idea of a pipeline. And this is a term that's used by the community development sector, where at any given moment, a community development organization, affordable housing developer, might not be building housing in the same neighborhood where the hospital perhaps would see it as being most valuable. But they are constantly looking for opportunities that are going to come to them down the road, 6 months, a year, 2 years from now. And in fact, partnering with a healthcare system that perhaps has resources or has political capital or other means to make a project move forward could actually really strengthen their pipeline of potential deals by making them more likely to happen. And so that makes the healthcare as a partner really valuable. And if I may, actually, Julia, I'll say that when we talk to community development organizations, one of the first things I always say to them is, look, don't think of hospitals as piggy banks. There can be a sense that hospitals, relative to the communities they're in, are often relatively wealthy, have a lot of money flowing. And I remind them that the $3.5 trillion a year we spend on medical care is all being spent. That money is going towards actual health care. Now, there's a lot of us who believe that there's a lot of avoidable disease and avoidable costs that we'd like to reduce. But the fact of the matter is there's not a lot of money sitting around. And so it's really about reaching out to healthcare and identifying where I think of them as pain points. Where are the pain points for the healthcare system? Is it a particular community or neighborhood that's driving a lot of the patients they see that keep their emergency room too busy or unable to, or may find it difficult to pay for hospitalization or other care? That would be a way in which that community development organization or healthcare system could really work together to figure out both where the needs are and where the resources are to work together quickly or work together to accelerate that kind of project.
Those are really helpful insights, and certainly sounds like community development and healthcare are a good match for addressing their shared issues. Do you have any examples of healthcare community development partnerships that really bring this to life?
I have a couple, that I think represent a couple different approaches. And I think one key idea in terms of how a healthcare system or hospital can partner is that it's not just about money. I think hospitals are well positioned in many cases with a lot of social and political capital, especially in local places. This could be important for changing zoning, for example. They also often are relative experts in terms of data analysis and actually health data, not personal health data, but rather sort of what data at the community or neighborhood level. They also have real estate. It's pretty common for hospitals to own land around them or near them that could potentially be developed into something that's useful to both the healthcare system and the community developer. And then, of course, there's the actual dollars. And so there's community benefit dollars that can be provided as grants to help pay for some of the costs that might be slowing down a project, or as direct investments coming out of the investment portfolio. And so with some of those ideas in mind, a couple of the examples that I think sort of highlight some of the different tools. One is a Nationwide Children's Hospital in Columbus, Ohio. And Nationwide, first, the thing they did was in an effort to improve the neighborhood they were in, which was really initially driven in part because it was relatively dangerous for the staff to park near the hospital and walk to the hospital. And there were a lot of empty lots, a lot of abandoned homes. This is on the east side of Columbus, historically disinvested neighborhood. And they started rehabbing homes, using their own resources and selling those homes to local residents. And so that then led to their direct participation with the local community development corporation to build something called the Residences at Career Gateway. This is, I forget how many units, but many townhomes and apartments serving low-income residents and a career center that trains local residents for jobs at the hospital. And it's walking distance. So you can see how they were using different tools to sort of tackle multiple social determinants at once. There's also several hospital systems that have decided to actually pull resources directly from their investment portfolio. It's 2 or 3% of their total investment portfolio to provide low-interest loans to drive this kind of work. And so Dignity Health, which is now just recently renamed Common Spirit Health, has I think it's a $140 million community loan fund. Trinity Health is another that has a multi-million dollar, I think $70 or $75 million for loans to the community, below market rate loans that allow, again, to accelerate these community development investments. And last one that I think is another interesting example is a partnership between ProMedica in Toledo, Ohio. Ohio seems to be on the forefront of some of this work. They partnered with one of the large national CDFIs that I mentioned, Community Development Financial Institutions, to create a joint loan pool of, I think, around $45 million. They're raising money, but also using some of their own capital to provide a resource for things like opening a local grocery store in a food desert and to invest in low-income housing. So there are more and more of these examples, which I think is one of the exciting parts of where we're at in this sort of intersection of these sectors.
Absolutely. I love hearing how creative people are getting to get resources where they need to go.
Exactly, yeah.
Are there any other sectors or entities or stakeholders that should be engaged as these hospital community development collaborations pick up steam?
The thing I like about this work is it tends to get stronger the more partners who are present. I think one group that absolutely is historically part of the community development effort, but I think there's always an opportunity to make it stronger, is the community itself. And this includes patients. Patients are community members, and so they have experience and expertise, and community development has a history of working by definition with community, but I think there's always an opportunity to strengthen that. And healthcare systems tend to know different people in the community, so I think there's an opportunity there as well. There are also a number of intermediaries that I think are well positioned to help the two sectors understand one another. For example, my own organization, the Build Healthy Places Network, a lot of what we do and what I'm really funded to do is to help both healthcare and community development understand each other's work. So, for example, we have a jargon buster to break down some of the terms. Terms like equity, for example, mean something very different in the finance world than they do in the health or social justice world. We have a partner finder to identify where some of these CDCs and CDFIs and housers are to essentially work with. We have success stories. We have a bunch of metrics tools to help figure out what the outcomes are, how to measure success. But there's a number of other national organizations that are well positioned. There's, importantly, the Healthcare Anchor Network is 40-some healthcare systems that have really taken on the idea of being an anchor institution, really focusing on the local community by taking on multiple roles, investing locally, hiring locally, and purchasing locally, so local procurement. And then some of these large, especially the large CDFIs, these community development financial institutions I mentioned, like Enterprise Community Partners or an organization called LISC, which is the Local Initiative Support Corporation, or the Low Income Investment Fund, or the Nonprofit Finance Fund. They all have resources to do technical assistance and support organizations in working together. They have a growing interest in health and healthcare.
Great. And I will say that I often refer people to your jargon buster. So what is your website in case our listeners want to go find it themselves?
Yeah, so it's buildhealthyplaces.org.
Perfect. Speaking of sending listeners to our website, if they're interested in what to do next, if they want to partner with community development organizations, what are your recommendations for next steps?
So I think, actually, to your point, I think a lot of what I've done at the network as a physician trying to help bridge the gap between health and community development is just learning more about the field. And so I think our Jargon Buster, as you mentioned, is a good example of that. We have a lot of stories, and I'll say that we work with an actual journalism firm that helps us write the stories. They're interesting, compelling, but you can see when you read these stories how they're happening all across the country. And they're not universal, but they're not located in just the big cities on the coast. This is really a national movement. And another resource is a chapter I wrote for a recent book called The Practical Playbook. So the Practical Playbook is really helping primary care physicians and public health professionals understand each other's work. And in that, and it's free, available online at Practical Playbook, is a chapter I wrote that summarizes a lot of this work. So it's a great way of getting used to some of the terms. I'd also just really suggest to listeners and to those in healthcare to consider reaching out to a local community development organization. Find out who's working in your community or in a community of interest. And again, the partner finder that I mentioned on our site provides links to directories from a number of these large national umbrella organizations or community development financial institutions to identify who's working where. And they're increasingly receptive because we're increasingly successful in talking to the community development side about their health impact. And they really get it pretty immediately. And so learning or having an opportunity to talk further with a local healthcare organization would be generally of great interest. And, as I said, what would that first conversation look like? Where are your pain points? Where are the places or people or populations that your organization struggles with or could use assistance with? And then learning where is the local organization, the community development organization working? Is there an overlap there? And I think then there's the last thought that I had was directly working together. There's an opportunity to bring community development organizations on board for the community health needs assessment. So CHNA can be a great place to work together, or to consider playing a role on a board of advisors or a board of trustees for a community development organization, or reverse, invite a local leader from the community development sector to join a hospital board, for example. It's a great way to get to know one another and build that trust as a healthcare system thinks about what to do next.
That's all really great advice. So one final question for today. How have you seen this field evolve since starting the Build Healthy Places Network, and where do you want to see it go next?
It's a great question. There's been a lot of movement, especially in the last couple of years. The first few years that I was doing this work, it was really what I look back and think of as consciousness raising. And it turns out consciousness raising is super fun. It's just about letting people know that there are partners from another sector who have similar interests and, importantly, have different resources. So they bring different type of expertise and different type of resources to bear on some of the same problems that we in healthcare and public health are thinking about. So that part was fun. Where we are now, though, is the how do we do it? And so that's a trickier question, and it really varies from place to place. There's no single answer, but the stories are growing. Some of the examples I mentioned earlier, some of the examples that we highlight on our site, recently Kaiser Permanente, for example, made an announcement about $200 million being pulled from their investment portfolio to be directed towards the type of community development investments. Like these sorts of large-scale stories, I think, are providing a sense of momentum that was not as true just a couple of years ago. And I think in terms of where we want to go is continuing to encourage healthcare systems to think beyond simply community benefit and really to think about how their underlying financial standing and sort of, as I mentioned, sort of their political and social standing, the role of their real estate in addition to community benefit dollars can play a role. And they have, I think, different roles to play, but coordinating that and having these departments and divisions within healthcare systems speaking to one another about how to maximize their impact, I think is going to be really important. I think the last big piece really is having healthcare and physicians and physician organizations really joining the advocacy for the types of resources that drive the community development sector that I was mentioning before. It's not uncommon for these tax credits that drive a lot of the affordable housing, for example, to be at risk of being cut or reduced. This is not just about the affordable housing sector or the community development sector making the case for these resources. These resources are directly influencing the social determinants of health that hospitals and healthcare systems are now worried about. And they're a really powerful voice, a really respected voice. And so I think there's going to be an opportunity for a greater understanding for healthcare systems to see their role as supporting the resources that are going into the community development sector, because that just will provide more opportunity to work together and accelerate this type of work and to really tackle the homelessness problem, the affordable housing crisis, the grocery stores and food deserts, all of these really important issues that are part of addressing the social determinants of health that I think are really important to healthcare these days.
Absolutely. And this is another really important tool in the toolbox as we think about how to improve health and well-being and equity for our patients and the communities that we serve. So thank you so much, Doug, for spending this time chatting with me.
Yeah, I really appreciate it. Thanks for having me.
For more podcasts and additional tools, resources, and education to help you promote value in your community, please visit the Value Initiative's website at www.aha.org/thevalueinitiative. That's it for today. Thank you for listening.